It's been an exciting 12 months here at NHS Leeds CCG, but now it's crunch time. We are into the 89th minute. The nerves are kicking in as our chairman, chief exec and chief finance officer are about to enter our annual general meeting.
So your job is to think like a patient and act like a taxpayer. You've spent £405 million of my money. So go on, where have you spent it? Who's first? You!
Well, before we talk money, let's all have a look at this.
19 out of our 37 GP practices are now open 7 days a week. 18 are now open 12 hours a day, Monday to Friday, which altogether, that means there's an extra 120,000 appointments.
And we also had a very special visitor and he wanted to find out more.
So more people can see a doctor. Great, but what if I don't need one?
Well, we've used some of the money to develop something called the Patient Empowerment Project.
Patient empowerment, patient empowerment. Go on.
The project helps give power back to the patients. We can help them access other services now, like debt management, ways to live a healthy lifestyle,
Is that it?
Well, no. It's a sad fact that some people have worse health than others because of external factors in their lives. This means they don't live as long as others when they could do. We're working to combat this.
How so?
We've been encouraging people to get cancer screening done when invited to, because if we catch it early, we've a better chance of treating it. And sadly, in West Leeds, the suicide rate is higher than elsewhere in the city. We've been working on projects to help people at risk, people who may be feeling unhappy or having some problems.
You know what? That's amazing to hear. Sounds like you're really making a difference. Now you, finance, have you met your key targets?
Well, every year we're asked to spend all of our budget, but to save at least 2%. And I'm pleased to say that we've actually managed to hit that target. In fact, we've saved more than 2%, which means that we've been able to invest more money in our primary care scheme. That's more GP appointments next year to you and me.
Okay. So you're good with my money. But anything else that's not gone to plan?
It has been a tough winter and we didn't quite meet our 95% target for A&E.
And we also saw a dip in ambulance response times.
And we didn't do so well with our healthcare associated infections and we missed our target.
However, we've got plans in place to address this.
And on a positive note, we've met our targets for waiting times, so that our patients are now treated within 18 weeks for planned hospital treatments.
And we've achieved our target for urgent cancer referrals on the 2-week wait pathway.
Great, but now let's get down to the nitty-gritty. Where exactly have you spent my money?
Well, sir, if you'd like to take a look at this delightful PowerPoint, you can find out. We spent £207 million on acute services. This is hospitals, ambulances. £53 million on community services, district nurses, health visitors. £52 million on prescription costs. £48 million has gone towards helping those who experience mental illness. £16 million for people who need continuing help with long-term health conditions. And £19 million on other services, joint funds with the council.
Okay, understood. But anything else you want to say?
We mustn't forget our patients and the wider public, especially those who volunteer their time to give back their views. We've seen great success with the Patient Leader programme. This is where our patients sit through the whole decision-making process for our services. Their input over the past 12 months has been fantastic.
And none of this would have been possible without the help of our 37 GP member practices, our staff, the views of our patients and the wider public. But then there's the support we've had from our partners, the GPs, the other health and care staff. Not to forget the staff at the CCG. We're grateful to our colleagues at the Leeds City Council, our partner CCGs, our providers, our community, our voluntary organisations, and you, and finally you, Mr. Taxpayer, because it's you who make this all possible.
Whoa, all right, Calm down. Where can I find out more about what you've done?
You can find out more in our annual report and accounts.
Or you can read our annual review.
Well, they're all available on our website, leedswestccg.nhs.uk.
Okay, thanks. That'll be all.